Hello, I'm very honored to be invited to this conference and to be given an opportunity to stand here now. It's the first time for me. I'm nervous a little bit. Let me introduce myself. My name is Anna Kassianova, project manager of Live Now Foundation and the head of palliative ALS care in Moscow. Last year, we've become a part of International Alliance Association. We both personal communication and exchanging experience has given our foundation a significant impulse to develop and to rethink our tasks and goals. That conference has revealed a certain need to share and transfer experience and learn from the others. In order to make this happen, our colleague from ALS Northampton cordially invited our team to visit their headquarters in May this year. Thank you very much, Sally. Not only did we organize a wonderful program covering all the aspects of their work, but also each day of the 5 days of our stay, we spent exchanging information and experience. We had a lot of meetings dedicated to these topics, such as raising awareness, fundraising, providing information, improving care, and supporting research and development of volunteering. We discussed the structure of MND associations and the way to reach every family affected by ALS. The main point where our opinions concur is the idea that our priority is to find each and every family affected by ALS and provide them with our care and support. In such a big country as the Russian Federation, this seems to be an extremely difficult task. Compared to England, where the government solves most of the problem, in the Russian Federation, our foundation is forced to take over a lot of tasks: fundraising, raising awareness, education, volunteering along with social help, and even creation of home cares. Inspired by our colleagues from ALS Northampton, we've created an educational plan for our colleagues from different parts of our country. Some of the educational materials were based upon brochure used in England. For example, we translated and adapted the speech book for the Russian patients. Driven by the example of our colleagues in the MND, we decided to make June the ALS Awareness Month in Russia, not only the 21st of June, but during the whole month, we worked with our colleagues from the mass media and ALS awareness campaign. We were really impressed by the branches system used in the United Kingdom, and we decided to create it and develop a similar system in the Russian Federation. What was the most surprising amongst all is the fact that branches here are both volunteer-based and independent. We realized that many of whose volunteers come from the families who lost their relative to ALS. We also plan to work with the relative of whose patient, who are not longer with us, and we have already structured the foundation family board. We see this institution as an analog on the volunteer branches in the UK. We hope to develop and implement the supporting program for teenage children patients based on practices of colleagues from MMDA within 2 to 3 years. We also see this as a vital request from their families. Also, we realized we need a hotline similar to the MMDA helpline, but As long as it is a matter of the human research we like, we are currently working on the base of the exchanging hotline for oncology patients. We've already had the training for operators, psychologists, and since July, we have the opportunity to give the hotline number to our patients. We have analyzed and knowledge. We've got adapt and our reality and adjusted to our experience. As a result, on 22nd of August, the ALS patients car service in St. Petersburg, one of the biggest cities in Russia with population of more than 5 million people, was opened. Yet the service itself financed from the fund, but we are working hard on the creation of a separate branch, which will be able to finance the regional home care, to develop volunteering, raise awareness, not always activists are headlined the Moscow office of the fund. In our case, we see it is a creation of local branches of the fund in different cities of the Russian Federation and involving families who have experienced the situation with ALS to finance a specific project of the branch. The ALS service in St. Petersburg at the moment has both a medical and a social parts. The service numbers 20 patients on a permanent supervision. The service has already held 3 outpatient receptions, 2 workshops of patient care for a relative, a group of physical support, psychological support. The service specialists have made more than 40 house visits. We have a cooperating agreement in place with State Hospital number 2 to create a green corridor for ALS patients in the outpatient consultation, hospitalization, for establishment of gastric fistula. Our plans. Next, we want to develop a high-quality multidisciplinary care for ALS patients in our region of Russia, raise awareness about the disease in the medical community and society in general, to change the system and the attitude to the disease at the government level. First of all, we plan to find the ALS patient in all cities and organize the assistance on the basis of medical centers, open the service that already exists in Moscow and St. Petersburg. We will be financed by individual branches and will be fully financed independent. Now we are contacting our colleagues from different cities of Russia, preparing training programs and training materials for professionals. We hope that the outcome of this training will be opening on the field service department already the next year. Thank you very much for your attention.